The best thing about sustainability in the NHS is its simplicity. We can take seemingly different ideas, such as saving money and improving health, and make them work together. For our NHS, it makes perfect sense. Whilst we provide excellent health services to the local community, we also need to help people lead healthier lives. In time, this will reduce pressure on our resources. We also need to make those resources go further. Sustainability is about looking at the way we work and travel and the way we buy and throw away. It's about embracing innovation to find new ways of combating rising bills. A visit to the GP is rightly about the patient's health. But let's involve the pharmacies too. Is there a choice of prescription drugs? Where are they manufactured? More production miles means more pollution. In urban areas, we're giving out air pollution maps to advise on the healthiest routes to walk and cycle. Our hospitals are part of the sustainability story too. A simple example is Operation TLC. Turn equipment off, lights out, close doors. With glaring lights, buzzing equipment and fluctuating temperatures disturbing patients' rest, Barts Health NHS Trust introduced TLC. It resulted in a third fewer patients complaining about sleep disruption and a saving of over £400,000 a year across 5 sites. Spending on wasteful practices has no place in our NHS. Sustainability gives us permission to find simple ways to avoid it, such as introducing solar-powered big belly bins that crush general waste, making it more transport-friendly, diverting food waste from landfill to biogas and fertiliser generators, reducing the amount of infectious waste incinerated at high temperatures by introducing an additional offensive waste stream, and introducing sharps boxes that can be reused over 600 times. We are always asking questions. Can we cut procurement emissions by purchasing goods and services that are better for our environment? Yes, and we can do it across construction materials, pharmaceuticals, medical equipment, transport and food. And what about clean on-site power generation? Barts switched to a low-carbon, combined cooling heat and power system that isn't just more efficient, but will save the Trust almost £500,000 a year. It's even been sprayed pink to help us raise money for cancer services at the hospital. In total, Bart's Health Sustainability Programme has saved the NHS over £9 million and almost 50,000 tonnes of carbon. Beyond our hospitals, let's seek partnerships to create healthier communities. Let's back programmes that improve children's food and fitness awareness. Cutting obesity saves lives and saves money by reducing future demand for treatment. Winter deaths and illnesses caused by cold homes need to be prevented too. That's why we give out information packs on how to keep warm without turning the heating up. This frees up NHS services, shrinks residents' energy bills and means less pollution. Aim for your trust to be the most sustainable it possibly can be. Drive innovation and best practice. Be energy savvy. Use less water. Send zero waste to landfill. And promote healthy living. The reward is simple. More of our precious resources focused on what matters most.